and have more time freedom. Okay, so without much ado, I would like to invite all of you, because over here we can't clap the hand, right? So I would like every one of you to help me in welcome Dr. Alfred by typing a lot of the 888, because Dr. Alfred just right after work and he's willing to spend his time with us. And let me share with you, Dr. Alfred is also one of the pioneer heart surgeon in Malaysia. And indeed, he was the one that set up the first open heart surgery unit in Malaysia outside of KL in 1987, and he's currently practicing in one of the major hospitals on the Penang Island. And he's very passionate about the integrative medicine, including the naturopathy, as well as he's a strong advocate of holistic health through healthy living and also the diet. And he has been featuring in many of the media, including the New Straits Times and also the Star Online. Okay, can we have a lot of 888 type in the chat room to welcome our guest tonight, Dr. Alfred, to have a chat with us. Welcome, Dr. Alfred. Let's have a date with our heart tonight. Okay, so Dr. Alfred, are you there?
Hello.
Hello, Dr. Alfred. Dr. Alfred.
Oh, sorry, I didn't unmute my microphone.
Yes.
Yeah,
Thank you so much once again for your time. We really appreciate it. You know, you just come back from the clinic.
Well, thanks for inviting me to
Yeah, you know,
tonight,
maybe I'll like
you're going to ask me some questions and I'll answer them as best I can.
Yes, yeah.
I'll ask some questions. People said, you know, you can ask that a wise man can't answer. So asking questions are always easy, but answering them may not be that easy, but I'll do my best.
Yeah, sure. Okay, I hope that our guests all have a wonderful takeaways, you know, to help them, because I believe that, you know, through, you know, looking at you, right? Maybe, you know, we'll start with something very interesting, right? All the guests here, all the audience here, right? Can any one of you guess how young is Dr. Alfred this year? Okay, can we have some wild guess, like how young is Dr. Alfred? Because to me, I feel that he's always looking young all the time, very much younger. So like maybe we can have a wild guess about Dr. Alfred's age. Anyone would like to guess? Okay,
maybe they can
type
write
in
it
the chat
down
room.
and you give them a TF present at the end.
Yeah, if who can guess it right, yeah, they probably would win a prize from us.
Yeah,
Okay,
I'm a cardiothoracic surgeon, and
I can guess. I can guess.
That's a good guess. 52.
Hello,
58.
Banha is not allowed to guess. People who know me.
Okay, yeah. Those who know, please help to keep the surprise, right? There are 58. Animal wild guess. There are people guessing 52, 60. Okay, 78. All right, 55. Good guess, right? Yeah. All of you are making really good guess, but I'll let Dr. Alfred himself to review, okay? Probably later, towards the end of the chat, we'll have Dr. Alfred to review what is the real numbers. Okay, 79, okay. Wow. All are good numbers. We'll let Dr. Alfred to share himself. Okay, so Dr. Alfred, you still there?
Yes.
Yes, yeah, because I couldn't see your screen. All right, so Dr. Alfred, you know, many times we heard about cardiac surgeon, but you know, as the cardiothoracic surgeon, we rarely heard this title. So what is your main medical expertise, and what's the difference between, you know, cardiothoracic surgeon and the difference with the cardiac surgeon? Can you share with us?
Okay, I'm a cardiothoracic surgeon, and the field of cardiothoracic surgery is a established specialty in medical practice. Well, if you look at the field of medicine as such, you could divide them up into two main groups. You know, there's medicine and there's surgery. Okay, The surgical specialties are, cardiac surgery, urology, which deals with the kidneys and the urinary system. And there's a general surgery, and a general surgeon that operates on hernias, lumps and bumps, and things like that. Well, cardiothoracic surgery is not a very common field. In fact, Kenny showed me a newspaper article that said there's a shortage of cardiothoracic surgeons in Malaysia. And he asked me, why is there a shortage of cardiothoracic surgeons? Number one, to train as a cardiothoracic surgeon is a long haul. It's quite demanding, and it can be quite stressful as well. So there are not that many people that go into the field of cardiothoracic surgery. Okay, cardio means heart, thoracic means the chest. So basically we operate on organs within the chest, which is the heart, the lungs, the esophagus, and the major blood vessels. That is our specialty. And what's the difference between other types of surgery? Some people specialize within the field of cardiothoracic surgery and do only heart surgery. So we refer to them as cardiac surgeons. And among cardiac surgeons, there's some who do adult surgery, some who do only children. And, we again split them up into pediatric cardiac surgery, adult cardiac surgery. And there's some others who are more general. They do both children, adults, lung, heart, and other chest surgery. So basically, I do adult cardiac surgery and lung surgery and also vascular surgery. Yeah. So that's my specialty.
I see. So it sounds like it's not an easy task, right? Like you mentioned, it's much more challenging, it's much more stressful, right? So with that, right, it's something not an easy task. So Dr. Alfred, could you share with us, like what inspired or what actually made you to take up this specialization, during your medical journey?
Yeah. When I saw a heart operation, it was like magic to me. And I was so fascinated that even when I was a medical surgeon, a medical student, I already decided I was going to be a heart surgeon. When you do open heart surgery, you stop the heart. And to a layperson, when you stop the heart, what happens?
Go to heaven.
Yes, you die,
Mm.
But you stop the heart for an hour, work on it, operate on it, and then you start it up again. And I saw that as a medical student. It amazed me that you could do such a wonderful thing. And so right from the time I was a medical student, I decided, yeah, I'm going to be a heart surgeon. And so it worked out. Your dreams do come true. Someone said, be careful what you wish for. You may really get your wish. Yeah? So here I am many years after training as a heart surgeon. I had the privilege in 1987 to set up the first open heart surgery program in Penang, which also was the only one outside of Kuala Lumpur. At that time, there were 2 or 3 centers in Kuala Lumpur that were doing heart surgery, but not in any other parts of Malaysia. So I had the privilege of setting up the unit. I remember the day, December 20, in 1987, we did our first open heart operation. Yeah, and it's been quite a number of years, more years than I would want to calculate. So that kind of gives off the answer to the question earlier, which I'm not going to answer.
Okay. Dr. Alfred, just wondering, during your time of pursuing to be in this cardiothoracic surgeon, are there any challenges that make you even have a second thought of maybe changing the path?
No. I was very focused, and this is what I wanted to do, and no turning back. No turning back.
No turning back. And you can't even count how many miracles, right? How many hearts that you have put a stop to, have restarted, right? You have lost count on that.
How many operations I've done? Oh, somewhere between 5 to 10,000 heart operations. Yeah.
Wow,
And
5 to 10,000. So still keeping to break your own records, right? I suppose.
well, I still enjoy doing it, and I think I'm operating
Mm.
better than I have ever done in my life.
Mm-hmm.
Experience counts. Uh, so I go to work each day. Or do I go to work? Someone said when you enjoy your work, when you enjoy what you do, you never go to work for the rest of your life. So I think I'm in that category. I don't
Wow,
really go to work.
congratulations to you.
I go,
Because
I go and
not
do
many
heart
can come to
surgery,
that stage.
something that I like doing. Yeah. And it's not a
Wow.
chore, it's not a burden.
Mm-hmm.
Sometimes I have to be up in the ICU the whole night. I get called up several times during the night, and some people complain about it, but well, very early in my career, I decided if you're going to complain about it, don't become a heart surgeon. Don't become a doctor. Uh, if you're a doctor, you're expected to answer emergencies, to be called outside of office hour time, no 8 to 5. 8 to 5, what is that? That's foreign for any doctor. Yeah, so if you have chosen the field, then you just have to enjoy it. Yeah, enjoy it. I enjoy being a doctor. I enjoy being a heart surgeon particularly. And I enjoy the whole subject of health. And, what is health really? It's not just the absence of disease. Health is a whole spectrum where you need to feel good, you need to live life, and but before you know it, it seems that you've come to the end of the road, or is there another road that carries on? Actually, as I look ahead, I'm seeing that there's another road that actually goes on longer than what most people think life is, and that really is the whole subject and interest of mine in the science of longevity. Yeah, you can talk
Wow.
about it a little later. Yeah.
Yeah. We'll save the best for the last, right, Dr. Alfred? Okay. So I think many are coming for the topic for tonight, right? Because I tell my friend, whoever has a heart, you gotta attend the talk tonight, right? Because we all have only one heart, and our best friends, right, has started working so hard for each of us since we're little baby, right? The moment that we were born. So how can we really take care of it, but it's quite sad that this precious organ of us, the coronary heart disease, we all know is one of the leading causes of death in the Malaysia. So what do you think, Dr. Alfred? What do you think are the main contributing factors, based on the cases that you have treated over the years?
Yeah. Coronary artery disease is an acquired heart disease. If you talk about heart disease, you can think about, of congenital heart and acquired heart disease. When people talk about heart disease in general, they're talking about coronary artery heart disease, where the blood vessels in the heart get a buildup of fat, and then they become narrowed, and the blood supply to the heart is decreased. And the most typical symptom of coronary heart disease is chest pain. We call it angina pectoris. And the typical type of chest pain that you see in coronary heart disease is it comes on when they exercise, when you exert yourself, and it goes off when you rest. So that's one of the earliest symptoms of heart disease. So if you have chest pain when you exercise and it goes off when you relieve and seems to come on at the same time, each time you take a walk, and it's almost very reproducible. You need to have your heart checked out, see whether or not you have coronary artery heart disease. What are the contributing factors? Of course, when we talk about coronary heart disease and heart disease, in short, we'll use the term heart disease. It is what is called a lifestyle disease. you'll find that it's only in recent times that heart disease has become the #1 cause of death around the world and also in Malaysia, in most parts of the world. There are some parts of the world where infectious diseases in the less developed world are still the #1 killer, and accidents and things like that. But in most of the developed world, you find that the heart disease is the #1 killer, and so it is in Malaysia as well. So what are the factors that bring about coronary heart disease? There are 3 main factors and some other minor factors. I don't really call them minor. The 3 main factors are #1, smoking. Okay. Of all the risk factors, smoking is the one that causes the greatest risk to a person. So if you're a smoker, you should think twice, and not only heart disease, you get lung disease, and also cancers of the lung that you're exposed, your risk will be increased if you smoke. Number 2 is a high blood pressure and high cholesterol, fats in our diets. It is said that you are what you eat. So lack of exercise, diabetes, and stress are other factors that are known to cause heart disease or predispose a person to heart disease. The last one, stress, is a little bit difficult to quantify because everybody has stress. So how much that contributes to heart disease is difficult to quantify, but it's definitely a factor. And of course, if you're a type A personality, the type A personality, the guy who's always very kinchong, who's worried someone will get the promotion ahead of him, who's always,
Or like very kiasu type, right?
Yes. Sitting at the end of his chair, in case someone goes in to see the doctor before he does, when it's his turn, that kind of thing. A person who's over anxious, because when you're anxious, you secrete a lot of catecholamines, a kind of hormone in your body that causes your blood vessels to constrict and makes your heart work harder, your heart beat faster, that kind of thing. So learning to relax is also an important aspect of treatment of heart disease. Yes.
Okay.
So those are the main factors. Yeah.
Okay. All right. So it's the diet part, is it? The high cholesterol, the smoking, and also the stress, right? These are the main 3 contributing factors.
I think stress is difficult to quantify, but it's in there somewhere. It's in there somewhere. Smoking, high blood pressure, high cholesterol. Cholesterol is sometimes it's genetic, and you can't do anything about it if it's genetic. But most of the time, it's related to your eating habits. It is said that you are what you eat. You are what you eat. So
Right.
now maybe we can talk about what is a healthy diet. A healthy heart diet is also a diet that is longevity diet, is Alzheimer's diet, is anti-cancer diet. A good diet is good for everything, really. And the ideal diet that you should have today is a plant-based whole food diet. Okay. Each of those words are important. Plant-based, I'm not saying you should be 100% vegetarian or vegan, but most of what you eat should be derived from plant sources. That's why it's said to be plant-based, okay? And it needs to be whole food. It shouldn't be processed. Okay, you should be able to recognize, the food you eat, that it's a vegetable and not in the form of a sausage. Do you see that in real life?
Right.
It's something that is manufactured by human beings, and in the process, a lot of additives are put in, a lot of preservatives, and so processed foods definitely increase your risk of heart disease and also increase your cancer risk. So those are the things that you try and avoid.
I think Dr. Alfred, maybe we should have another talk about you sharing with us your plates, right? Like how you actually plan for your breakfast, lunch, or maybe not dinner, right? I think you do not take dinner. Is that right?
I'm not the ideal person,
Mm.
but I'll be happy to do that sometime. Yes.
Okay. Yeah, maybe you can share a few cents. Yeah. So like Dr. Alfred, what type of people are more at risk, with this heart disease? Does that dictate by, a certain sex or a certain age, more higher risk than the others?
Okay, coronary heart disease is
Mm.
related to age, there's no doubt. It's kind of rare for people under 40 years old, 30, 40 years old. It's becoming more common now, but it's rare unless you have a genetic predisposition, have a genetic predisposition for high blood fats. There's some people who genetically produce very high beta lipoproteins. So they have blockages of the coronary arteries early. I've operated on someone even in in their 20s with this condition where it's a genetic condition. But most people get coronary heart disease when they're older, 50s, 60s, 70s, 80s, that kind of thing, with age, okay? Males are more common till women after the menopause, they kind of catch up. So by 60, it's almost even you get between male and female. Age, older age, yeah. The common types of treatments are number one, to address your risk factors. Certain medications you can take to lower your cholesterol levels, especially your LDL cholesterol, the bad cholesterol, and your your ApoB protein. Now, you also need to treat high blood pressure to make sure that your blood pressure is well controlled if you have high blood pressure. You need to treat your diabetes to make sure it's well controlled. You need to have an exercise program, and of course, change your diet, and stop smoking if you're smoking, if you're a smoker. Okay. In terms of exercise, at least 3 times a week, where you need aerobic exercise. In other words, you need to be out of breath. Okay. You need to exercise till you feel short of breath that you can't carry on a conversation with someone next to you. You need to reach that level of exercise. So, it stands to reason. If you want something that you don't have, you want better health or fitness, you have to go to the limit, the edge. If you're always comfortable, you exercise and you don't even feel tired, you don't even break out in a sweat, that's really not exercising. That's not really exercise. So if you have heart disease, your exercise needs to be prescribed, it needs to be tailored. How much you do, there's always what's called a cardiac rehabilitation program with physiotherapists after your heart surgery or even when you're having medical treatment, okay? So it really depends on the stage of your heart disease. If your lifestyle modifications don't help, then there are medication that's given to you. And also, finally, there's surgery that can be done or coronary artery stenting, angioplasty and stenting. Okay, in terms of the diets for heart disease, there's certain diets I'll mention here. We can't go into details, but you can look them up. There's the Dean Ornish. Dean Ornish is a very well-known researcher and author and practitioner. In fact, he will pay for your bypass operation if his diet treatment doesn't work. Okay, Dean Ornish, that's Esselstyn in the Cleveland Clinic. That's, of course, the Pritikin diet. So these are some of the diets that have shown to help arrest or even reverse heart disease. Heart disease can be reversed. It doesn't mean that it will progress to more severe states. I think that's the important message you need to take home, that even if you have heart disease, it can be reversed.
Oh, Dr. Alfred, so you were saying that heart disease can be reversed, but it has to be, in multiple methods and aspects that we have to combine together, right? Because
Yeah.
all this while, like especially our elderlies, they have been always told by the doctors, oh, okay, if you're on a high blood pressure and also the cholesterol medication, you have to take it for the entire life, right? And a lot of people, they were taking it this way, as in, oh, so long as I'm taking my medicine on time, I can still continue to enjoy all those food, whatever that I love, I can still put it in my mouth, right? So is that a right mindset? Or if there's any way that, you can share with us so we can talk to the elderlies that we have at home, how they should doing certain kind of adjustment.
Yeah, I
Not
think
thinking that the medicine
that
is the only
speaks
thing that can
to
help.
the human nature to find an easy way out.
Mm.
As I mentioned earlier, the concept of coronary heart disease, it is a lifestyle disease. Years ago when most people worked in the fields and eats ate very simple foods, plant-based foods, not very much meat and fat. There's very little heart disease, and so you see that in places of the world today. Heart disease is a modern disease of our civilization. So you need to have that concept. So you can't just pop medicines in your mouth and do whatever you want. Okay, that's a very wrong concept that will certainly not work well for you. Okay, sometimes you have to take medication, and I think you should. But the primary focus is, if it's a lifestyle disease, how do you treat it? If it's a lifestyle disease, you treat it by lifestyle changes, right? So that should be your primary focus. In other words, if you're overweight, you should go down to your right weight. You should eat a plant-based whole food diet, exercise regularly, sleep well, and take medication as necessary if you have to, or even if you have to have a heart operation, you do that. But don't just do one thing and think that that's going to solve your heart disease and cure your heart disease. It's a total approach to the issue that's important. There's no one silver bullet. Yeah. So the components, as I told you, is healthy diet, enough sleep, enough water, exercise, and meditate and keep yourself calm. Meditation definitely does play a part. It helps too. In other words, there's the mental, there's the physical, and there's the, again, there's the social and spiritual aspects to the approach to heart disease. Yeah. So
It has got to.
not just one thing. Yeah.
Not just one thing. We have to put in the work, right? In various aspects.
That's
Yeah.
true. My mother always told me,
Mm.
if you want something worthwhile, you have to work for it. There's a struggle for it. It doesn't come easy. Yeah? And so it's the same thing with health. You want to be healthy. You want something that's worthwhile. It doesn't come easy. It doesn't come cheap. It requires effort, and it requires discipline to make it work. Eh?
Thank you. I believe that's why we have great audience here, right? I believe all of you here, you are truly after your health, right? I believe that you take your health seriously. That's why you're spending your night here with Dr. Alfred, wanting to learn more on how to take care of your health and your heart. So like Dr. Alfred, right? Being in this field, like why is the rate of heart attack is still increasing, over the years, despite we know there are the medical science and the technology advancement, but why there are still more and more, and in fact, there are also sudden death, increase as well. Can you
Okay,
share
in
with us more on
terms
this?
of heart attacks, whether they're increasing, that really depends on the area that you're talking about. In the US and a lot of developed countries, for example, heart disease has actually decreased. So the preventive measures have been working and it's actually decreased. Maybe sometimes it's the heart disease that's diagnosed more readily with all the medical facilities that are available today. So the numbers may appear to be increasing. Why? I mean, this really begs the question, you know, will medical technology ever cure us of our problems? Medicine developed along two, or a line today as we call what is called allopathic medicine. That's the medicine we practice, you know, that's licensed in this country as what we generally call, you know, a doctor in the hospitals you go to, or Western medicine. These developed from sponsorship from drug companies. So a lot of medicine today is about prescribing medicines. And medicine developed in this track because medical schools were aided by drug companies. They gave a lot of money to develop, and a lot of research is done by drug companies. So the whole thinking shifted towards, you know, medicine being a prescriptive type of practice rather than developing physiotherapy and, you know, other types of medicine that needed a lot of funding to develop. But medical schools developed because they was supported by drug companies. So today, even we have this whole problem of drug companies dominating medicine and sometimes not giving us the, you know, the right information, or there are a lot of instances in which patients come to harm by taking prescription medication. In fact, the deaths from prescription medication is about the third or fourth most common cause of death. So it's very substantial. So in other words, I'm sorry.
Sure.
In other words, you know, don't take medicines when you don't do. You take medicines only when you need to, when the benefits outweighs the risk. Any medicine has got risks, has got side effects. So you need to take medicines that, you know, you need to weigh whether taking a medicine, having a procedure outweighs the risks, that the benefits outweigh the risks. And you always, you know, weigh the benefits against the risk. There's no medicine that doesn't have a side effect. So as I say, you know, to have optimum health, you cannot depend on your doctor, you cannot depend on the government, you can't depend on drug companies. I think each individual has to take hold of their own health. Number one, I'm sorry, I just answered hospital. This is a doctor's life. Hello.
Of course.
The ward is trying to call me. So you see, you have to take a hold of your own life. You can't depend on someone else. You need to be knowledgeable. You need to know what your risks are. You know what the treatment is able to do for you, what medicines are able to do for you, what a good diet is able to do for you. You know what enough sleep and rest and, you know, healing is enough can do for you. So you need to be knowledgeable about health. So that's the reason we're all here talking about heart disease.
Yeah, I think
Which again
thank you so much.
It's a very emotive disease, you know, when you talk about heart disease, and you're quite right, you know, you have only one heart. So you should take care of it. But there's nothing romantic about the heart, you know, it's a pump. It's basically, it circulates blood around your body. It's a muscular pump. You know, there's
Okay.
nothing romantic about it, Fiona. It's, you tell your
Well,
husband, I love you with all my heart, you know, or,
mhm.
yeah, heart, I love you with all my pump. Yeah, very, very unromantic, very unromantic. Yeah, because the
Yeah.
heart has come to symbolize what is good in a person, you know.
Mm-hmm.
The symbolism of the heart among cultures around the world is very interesting. It always, what's your inner self, your true self, you know, it's come to represent your heart. And also good is represented by your heart, your courage, you know, uh, all is represented by the heart, by the heart. And of course, when the
Mm-hmm.
heart stops beating, a person is dead. And that's the way the doctor tells that the person is dead. When there's no spontaneous heartbeat, there's no breathing, there's no spontaneous life. And then that's death. So at the end, whatever disease you have, the end point is when your heart stops beating. Yeah.
Yeah. And it's not cheap to get a heart replacement, right? Dr. Pui, can you share with us roughly what is the average cost if someone were to get like a heart transplant? What is the price now?
Oh, you're talking in, 200,000 in the life of the patient, you're talking of, millions in terms of
Mm,
care and follow-up. We
mm,
don't do much heart transplants in Malaysia. It's a kind of a luxurious form of health treatment. Yeah,
mm,
but heart and lung transplants are definitely, available in this day and age. But
mm-hmm.
yeah, and done a few heart transplants in Malaysia, but I don't hear much about it now.
Oh,
On the
all
whole,
right.
Malaysians, they don't like giving their organs. They
Yeah,
like to die with with everything intact. Sometimes
yeah.
it's cultural or religious reasons. So
Okay.
yeah.
So it doesn't mean if you have the money and you will definitely get someone would like to
You have a kidney, you're more likely to get a kidney transplant. Like you said, there are
uh
two kidneys, so sometimes you can get a kidney from a relative, or someone dies, you can get two kidneys for two different people.
mm.
Whereas the heart, there's only one heart.
So we really, really need to take care of our heart, yeah. And I think you are the right person that we all can get some tips from, right? Because like looking at all the years of experience that you have gathered, and also I understand that you read a lot, you read a lot of the research and studies. So Dr. Pui, like just now you also sharing about heart is not just about pumping, but it also means something deeper, right? Like how the person having, like we always say, people are having a good heart, right? Like I understand that you are someone who also have a belief on embracing holistic methods, right? I think the audience can get your vibes too, like through your sharing. You're not just talking about just everything is all about medication, but it has to be in a various aspects. So alongside with the conventional medical care, like you mentioned, there are some lifestyle changes that a patient needed to do, right? And how do you actually incorporate all those knowledge that you have into your practice for your patients?
Yeah, it takes time, talking to each individual patient. I think
Mm.
the first thing I do is for a person who, if he smokes, is to convince him not to smoke. And there's one thing I do to most patients, and they say they smoke, and I tell them straight away, that's out of your life. Okay. Uh, Diet is, as I mentioned, it's very important, but it's a bit difficult. People are used to, their own
Mm.
diets. Not everybody cooks as they do previously. So to eat plant-based whole food diet is challenging to some individuals, but I think that's important uh, to incorporate. We have a cardiac rehabilitation program that is instituted after heart surgery to incorporate the physiotherapist into the changes and the recovery from heart surgery. Uh, when you come to the hospital, you also have a dietitian that comes and talks to you about, heart healthy diet. Again, a lot of Just a diet, I'll just give you an acronym, okay? Just a quick one for you to remember. It's called G-BOMB. Okay, remember it. G-BOMB, okay? The first G is grains, so whole grains. Yeah, greens. Yeah, maybe you should put greens first, okay? So dark green leafy vegetables. All my patients get told to eat this. A lot of dark green leafy vegetables, okay? The darker the color, remember, among plant-based foods, the better it is. So even if it is green, the darker the green, the better, okay? Greens, that's the first B, yeah? G bombs, the G is green, sorry, B will be your beans, your legumes, okay? So we eat a lot of red beans, green beans, mung beans, are quite common here in our culture. We eat a lot of that, so, that's good food that you should eat. So G bombs are the first B. B, O, onions. Onions have a lot of quercetin that improves your immune system and also feeds your microbiome. This is another word that you should become familiar with. The microbiome is all the good bacteria that lives in particularly your gut. The gut microbiota is a very important place that regulates your immune system. In fact, 80% of your immunity is regulated inside your intestines. And inside your intestines, you have 3 trillion bugs. Okay? In fact, they weigh more than your brain. So you just remember that, okay? I'm going to say a word my mother would spank me for. The microbiome weighs more than your brain. You have more shit than brains, okay? My mother always told me never use the S word. So she's not here anymore to scold me. So your microbiome, okay? So you feed the microbiome by taking prebiotics. Prebiotics are basically your fiber-based foods that feeds the good bacteria in your intestine, okay? And to get good bacteria, you also need to take probiotics. Okay, there's prebiotic, there's probiotic. Okay, they're two different things. And your microbiome, there's all the bacteria that lives in your intestine. So that regulates a lot of your health, a lot of obesity, your blood sugar regulation, your brain function. It's all related to this microbiome that you have. So take care and feed your microbiome. So we go back to our G-bombs because don't get distracted. So that's onion.
Now
M is mushrooms. Yeah.
mushroom. Okay.
Mushrooms. Eat a lot of mushrooms. Huh? Next B are berries. Okay. Raspberries, blackberries, blueberries. These are most common berries that you can eat. The berries. What else? S
Last one.
seeds.
S.
Seeds, okay? And the most easy seeds that you can get are pumpkin seeds and sunflower seeds. And if you have problem with your blood fats, eat 1 Brazil nut a day. 1 Brazil nut, okay? That will straighten out your triglycerides and your cholesterol issues. Just 1 Brazil nut a day. All right? Now, I was going to say yes. Studies have shown that people who eat nuts, have a low incidence of heart disease. And in fact, in the British Medical Journal, there was an article, editorial said, nuts for you and you and you. So eating nuts, a handful of nuts a day, will certainly benefit your health. Firstly, it's a protein. It gives you satiety. It makes you feel full. You don't eat so much. It will help you control your weight. Studies show that, you live longer. In these blue zones, if you know this book by Dan Buettner, In Loma Linda, there's an area in California where a lot of Seventh-day Adventists live, and they eat a lot of nuts. Okay, in Okinawa and Sardinia, places like that, where we talk about the Mediterranean diet and the Okinawan diet, which is a lot of actually sweet potato and other raw things and some seafoods, I'm saying fatty fish, okay? That's good for you that you can eat, which means sardines, salmon. These are fatty fish that so you don't need to be strictly a vegetarian, though it's better if you are. Vegan, even better still. You still can have a healthy diet by eating a plant-based diet with judicious amount of meat. White meats, next level. Definitely avoid red meats. Red meats are basically beef, lamb, pork. Pork's quite whitish, but it's still classified as a red meat. There are a lot of fat. And for patients, heart patients, fatty fish is not only okay, but also may be good and helpful. So here the most two common types that you can eat are sardines and salmon. Okay. Then, as I was saying, incorporate seeds. So the G bombs are the healthy foods that you should eat. Easy for you to remember. All right.
Yeah, G bombs. Okay.
Okay.
We got that registered in our brain already, I think, by tonight. But yeah, Dr. Alfred, just now you share with us about a lot of plant-based diet and also the herbs, right? Like I know you personally have interest and also you have knowledge in herbs and also you enjoy your own homegrown herbs and plants, right? In fact, I think you have a garden of your own. Can you share with us, some of the good herbs and foods that can help to support our heart health and also our overall health? Are
Yeah,
there any?
overall health, one common herb that grows in our balcony and a lot of people is rosemary. Rosemary is it has got of antibacterial properties. And it's a herb that is commonly grown that you can eat. Then the other herbs are basil that we see commonly here that it's grown, dill, and yeah, herbs, the whole subject that we can take on sometime. But again, in terms of what you eat every day, try and eat some cruciferous vegetables, some like broccoli, cabbage, kailan, dark green vegetables. That will be
That means vegetable. Okay. Dr. Alfred, could you also share, because people nowadays are so busy, right? Like some people might don't even have a garden. They are not able to grow their own plants. Like myself, I'm not good at growing any plants. Most of the time, my plants will just die in just a few days after that. So like for people who do not have that luxury of time to grow their own plants and
Don't go
things.
to a doctor whose garden plants have died,
Uh-huh.
Don't go to a doctor whose aquarium fish have died. See, it doesn't take care of them.
Okay.
Yeah, I understand what you mean. And the question that you asked me earlier that I'm quite willing to answer. Now, do I take any other things besides eating a good healthy diet? And do I take any supplements and things like that?
Yeah, because I heard that you take like
My
30
short
over.
answer to you is that yes, I do take. As a matter of fact, I swallow 32 tablets and capsules every day.
Wow. That's a lot.
Yeah, there is scientific knowledge that you can use to your advantage too. So that's why I say that, my whole approach is an integrative one. It's not just, exercise and eating or just medicine or just surgery and so on and so forth. I think it's the whole gamut that interests me. You can improve your health by eating well. You can improve your health having good sleep and so on and so forth. You can also improve your health, even improve your lifespan by taking some supplements. For those of you interested in the whole subject of longevity and aging, I would advise you to look up David Sinclair, okay? He's a professor at Harvard University. You can find him on YouTube. David Sinclair. There are other aspects of health and longevity that we'll come to. Okay, I'll talk about supplements and then I talk about the role of fasting, you see, and intermittent fasting, okay? So these also come into the whole picture of integrative health. So what do I take? I take, as I told you, some 32 capsules or tablets a day. And well, you may be happy if you know a lot of them are actually from 4Life, you know.
Oh, wow.
Like
So
for
what
example, I take Renuvo.
renewable? That's for stress.
Yeah, for for rebuilding up, or renewal, as it were. It's also quote unquote something for longevity. I take the BioEFA, which has got the omega-3, and I take Vista. I take TFCV. I take a lot of things. I take glutamine plus. I take
Vitamin plus.
Yaran. Well, what else do I take, man? I think a lot.
Bountiful Harvest,
Yeah,
right?
Bountiful Harvest,
Lots
I
of
do. I
energy.
take that. And I take TF plus, Rovida juice.
Wow.
And I also take supplements that are not for life. For those who be interested in longevity, there is a molecule that you must look up and come to understand. It's called NMN. NMN. It's nicotinamide mononucleotide. If all your
NMN.
body's energy actually comes from what is called NAD, nicotinamide dinucleotide. These are all terms, biochemical terms that may not mean anything to most ordinary people, but these are all processes in your body from where your energy comes from. So, and NMN is a precursor of NAD. And the NAD levels drop as you get older. But if you can boost it up, you find that it's been shown in the lab at Harvard University where David Sinclair works, that older mice given NMN outperform the younger mice, and and they're running on the mice treadmill, you see, on the rollers that they run in the lab. And in fact, they live longer than the mice that don't take NMN. So does that apply to human beings? Don't know. You can't really translate that so much, but if you're going to wait by the time they find out yes or no, I think you may have missed the boat. So I weighed the risk, for example, I don't think it's harmful, so perhaps it'll benefit. It could benefit, and increase your lifespan. You can translate that from mice, okay? NMN is one of it. Others is quercetin, alpha lipoic acid, alpha ketoglutarate. So these are some of the other supplements that people interested in longevity would take. Yeah, we can talk about longevity at some other time, Some other time.
Yeah, definitely you're the expert. No wonder you are like you're like looking 20 years younger, right? With all of these secret weapons that you have, right, Dr. Alfred?
Yeah, I'll be honest, I'm not too sure what works and what doesn't work. But the
But you
combination
feel it, right,
the
ultimately?
combination the combination of them seems to work for me. You know, I'm still active, and you know,
Mm.
I walk faster along the corridor than most of my colleagues who are half my age.
Yeah.
Yeah, so you know, I
When you
feel
feel healthy, like age is just a
healthy.
number, right?
Yes,
Correct?
yes, yes, yes.
Yeah.
But
I
what
always
I'm
believe.
saying is that, you know, before you know it, you already reach the, you know, you reach the numbers, you know, pretty fast. You wonder where all the years have gone by. So whatever age you are, I think you should take stock of what you eat, because it is true. You are what you eat. Yeah, you are what you eat.
Mm.
And then having a healthy life is not about eating; it's also about not eating. And there's a lot of
Mm.
research that shows the benefit of fasting. Okay.
Oh,
Oh,
yeah. Oh, yeah, Dr. Alfred. Just now you were talking about some of the herbs, right? And you're also talking about the CV that you take. Do you mind to help take a look at these ingredients and
oh
share
yeah.
with our audience like what are goodness in these ingredients that you're taking that can help? Hmm.
Ginkgo, as you know, is a well-known herb. I mean, a natural extract that is used in medicine for a long time. It's used in conventional medicine, you know. Tanakan is a common drug that people take who want to increase blood flow to the brain. For memory, if you go tell your doctor my memory is bad, he probably give you Tanakan. It's basically nothing but ginkgo. So it's
Mm.
also used in conventional medicine, very well known biological product that increases blood flow in your body. Increasing blood flow. So increase the blood flow to the heart, and yeah. So TFCV contains a lot of the, you know, biologicals that certainly support heart health. You know, garlic is well known, as a lot of you know.
Mm.
Hawthorn, yeah. Beetroot and red rice seeds. Again, you see fruits and vegetables that have a lot of color. Basically, these are polyphenols. You know? Polyphenols are very strong antioxidants that help remove the charged particles in your body. When there's a lot of activity in your body, has a lot of breakdown, you need antioxidants to repair the oxidative damage. Oxidative damage basically means when oxygen combines with other substances in your body and burns off. You know, your body needs to be repaired and refreshed, and antioxidants play an important part in this process. So yes, I
Mm.
take transfer factor, CV, cardiovascular, and the VMC, which is the targeted, you know, vitamin and mineral complex, vitamin and mineral complex that you take. And yeah, I'm saying there are a lot of other things in the 4-Life products that are useful, but I wanted to zero in on this last aspect of not eating also being good for your health. You know, fasting is a practice that is seen in all communities. The benefits have been known for centuries, and also from spiritual communities or even just ordinary communities, okay? The best way if you want to lose weight really nowadays is, the buzzword is intermittent fasting, and they say about 10 or 15 to 20% of people in the world have actually experienced intermittent fasting, practiced intermittent fasting. In the last few years, it's really become widespread knowledge in the last few years. In other words, you eat for a window period of between 6 to 8 hours, and then you fast for 16 to 18 hours. 6 to 18 is better than 8 to 16, okay? So in other words, within a window of 6 hours to 8 hours, you have 2 meals. Whatever you want to eat, it really doesn't really matter that much. But so long as you don't eat for the 18 hours, you'll find that your body will start utilizing all the stored food in your body, and it'll burn up all the fat, it'll burn up all the fatty liver that some of you may have, or the abdominal fat, and you will lose weight. So in terms of weight loss, intermittent fasting actually has become very popular during the last few years, all over the world, So in fact, when you fast, what happens, your body begins to break down cells. And if you fast, say, the period 24 hours or after 18 hours, your body begins to break down cells. This process is called autophagy. That means your body eats up its own self, but your body is very smart. It will recycle the useful parts. It'll get rid of the useless cells, the parts of the cell, and recycle the good parts of the cells. And autophagy actually is a field that was researched by a Japanese guy by the name of Yoshinori Oshimi. And he won the Nobel Prize for Medicine and Physiology in the year 2016 for showing the benefits and usefulness of autophagy that occurs in the body. So have periods when you fast. There are many different types of fasting, or whatever it is. If you fast for a day, every so often, actually, it's a good thing. It's a good thing. You can fast a little longer. Take water, though. A water fast. Not say don't drink. Drink water is okay. It's fine. But you'll find that the process of autophagy will kick in, and your body will actually get rid of a lot of unwanted toxic products that you have accumulated. In fact, even the spike protein from the vaccination that you get, this whole discussion, for you who may be interested, the spike protein, to get rid of it from your body, the main way of doing it is by fasting, intermittent fasting. So your body will break down and get rid of the spike protein and recycle the mitochondria and the other useful parts of the cell. And there are a lot of health benefits to be gained by fasting of various types. Today, we can't go into the various types of fasting, except to say the intermittent fasting is something that you can practice if you want to lose weight particularly. So you find that fasting and detoxification all been incorporated into various programs that have come into existence today that helps in our overall health. And one of which is in this group here, the IDX group, and Fionn will take you through what they do at the IDX program to detox and rejuvenate your body from the cellular level up. Fionn?
Yeah. Once again, thank you, Dr. Alfred, so much for your time. Can we all give a lot of 888 to thank you, Dr. Alfred, for sharing his precious time and also a lot of the great tips to us in terms of staying young and staying healthy, right? We definitely would like to have Dr. Alfred back again when his time is allowed. Thank you so much once again, Dr. Alfred. Perhaps the next time we'll invite you to talk more on longevity, right? Thank you so much.
Okay, thanks, Fionn.
Yeah, thank you so much.
I'll be
Yeah.
around in case there's some questions later.
Yeah. In case there are some questions later, then I'd like to invite you again. So like Dr. Alfred mentions, right? Like fasting and detox has really been in a trend, and it has been proven that to bring great health benefits to us, right? And from VDEX, our founders have actually launched this IDX program, which combine the fasting and detox together to help regenerate and also reboost our body to a whole new healthy level. So what is this IDX program actually is, right? Is designed by our VDEX founder, the naturopathic doctors. And also this IDX program is created based on the science, like what Dr. Alfred has mentioned. It includes the detoxification, and it also has this diet plan of like how to actually consume after the after the detox, and also we'll incorporate the exercise and also the one-on-one coaching, right? Because some people, they may not have done detox before, they might have some fear or worries, but fret not, because you'll be guided with experienced coach on how to go through this IDX detox program. And the whole purpose is to actually create a healthier body and also to help our body to achieve an ideal body shape and also to feel the optimal health once again. Okay, so the IDX, what does it comprises of, right? Like some people, they might be thinking, oh, so if I were to do fasting and detox, like will I be feel so hungry or weakness? Do not be worried, because in this IDX program, right, there will be 90 over nutrients that will be supporting your body to be able to go through the daily tasks that you need. And of course, it will go down the deep purifications at the cell level. That's why it's called the cellular detox. So at the same time, while we are doing this IDX, right, it helps to regulate and also balances our immune system with the patented ingredients called the transfer factor inside. And at the same time, right, many of the times, we heard a lot about liver detox or colon detox, which focus on only one part of the organs. Whereas for IDX, right, it's the cleansing of the 7 major organs, like all of our 7 major organs will go through the detoxification together, inside our body. That's why the result come so much more effective, and it is quite soon that we can feel the health levels that we have long not been feeling that great again. So later I'll be sharing with you some of the great sharings from the coaches and also some of the clients. And of course, in this IDX program, it has been tested safe and no side effects, and also it has been widely recommended by the medical and healthcare professionals. Yeah, and also it has the exclusive formulation, like we say, is the patented TF, that is the immune molecule that will help to regulate our immune system during the process. And also it also helps to eliminate something very we rarely heard of, but like a lot of time people say, they have been fighting with the weight loss issues over many years, but they still couldn't get rid of that. It's because there is a virus in our body which is called the obesity virus 8036. Maybe you can Google it up. So during this IDX detox process, right, it will also help to eliminate this 8036 virus in our body. Okay, so this is the features about IDX. If you'd like to know more, maybe you can ask your friends who have invited you for this talk, right? So with that, right, like what Dr. Alfred has shared just now about the CV formula and also the IDX program that we have helped throughout the years, right? Right now, I would like to invite some of our coaches who have helped their friends and people around them to regain their health, either through the CV sets or even through IDX, to share the real story with all of you. Okay, so for the first one, I would like to invite is our very experienced IDX coach, which is Coach Kenny. So this is one of the clients that he has helped. So I'd like your help to type a lot of 888 to help us to welcome Coach Kenny to share one of the cases he has helped. Welcome, Kenny.
Hi, Fion. Thanks for the introduction, and also thanks, Dr. Alfred, for the very enlightening sharing today. So a quick one, since we're running out of time, I'll just share what my experience with one of the friend, I would say a friend of mine, right? But introduced by one of my coach as well, Mandy, right? And Mr. Chong is actually someone that we have heart pacer, right, into it. And even that, she's having high blood pressure with about 150 with medications. Imagine that, right? And he's panting, right? He's panting while walking up the stairs, we're walking few steps, and he's having cold sweat. So he's not healthy even with the heart pacer. So what happens that after he did an IDX, and the moment between the first few days of fasting, right? That's what Dr. Alfred mentioned, fasting autophagy and all that happened. You can see the blood pressures went down to about 130 and 120, and she actually recorded every single day. Okay, and after the whole program, right, she regained not only a healthy blood pressure, without medication. At that time, he was trying stopping it, although I'm not encouraging him to stop, but he trying to stop it. And he tried to test if it's back to normal, if which is really hard. Right? You can see the pictures 120 over 79. It's very healthy. So what happened is that after the whole program, he able to walk. Not only walk, he able to travel right now and go many places. He's a constructor, developer kind of thing, right? And have a very unhealthy lifestyle, right? Before that, right? Right now he changed, right? Like what Dr. Alfred have said, you have to change your lifestyle. This, right? And of course, with the fasting, with the VDEX program, it helps him tremendously. And imagine that he continues, right, the program ever since. That was like 2-3 years ago. So he's very believe and into it, and she takes CVVMC, of course, right? And his health have changed then, right? With that, I pass it back to you, Fionn.
Okay, thank you so much, Coach Kenny. This is like truly a great news, right? Like someone who has changed their lifestyles, right? When they see hope, then they see, wow, that's really a way for me to change my entire lifestyle to be a healthier one, right? I think VDEX is truly a great transition, you know, like a transition platform for people to changing their habits and also their lifestyle to a greater one. Thank you again, Coach Kenny. So the next one I'd like to invite is a physiotherapist in our team. Her name is Yiwen. Yiwen, right, it's very hard to get her appointment. Her business is so good, right? So we can imagine how many people actually need her service, right? And throughout this year, she has helped many stroke patients to regain better health. So let us welcome Yiwen to share one of these amazing case that she has helped. Okay, so let's welcome Yiwen.
Hi, thank you, Fionn. Yeah, this is one of the amazing case that I had. So I'm a physiotherapist for 12 years. So we see many stroke cases, but this case is very special. And today I would like to share his progression. So when we take over this case, he's actually had the history of stroke for more than 8 months already. Okay, so we know that stroke for the first few months, if he didn't get any recovery, the recovery will be slower. But for his case, even though for the first 8 months, he's bedridden on the bed, no any functional ability. So the wife called us to go for have a look and started physio for him. So when we start physio for this man, the recovery is quite slow. The response is quite slow. So because of his wife was also a nurse, so she actually asked us any recommendation for any supplements or any support. So we actually say that, oh, you can try on For Life CVVMC, the set that Dr. Alfred mentioned just now. So he actually started this CVVMC together with physio. So after only 1 month of physio and TF together, the CVVMC together, he started to show some good response. The limbs movement and the speech abilities improved quite a lot. Okay, he started to learn. You can see the first picture. He started to learn how to walk, but with the support from the family. So after 7 months of non-stop physio and also continuously of the CVVMC set, the supplements, so we are quite surprised that he actually gained back his ability to walk like normal. And he's now off physio. He's back to his gym instructor life because he regained almost over 90% of his functional ability. And his reaction and all abilities is still very good now. And this is one of the great case. And yeah, this is my sharing for today. I pass the stage back to Fionn.
Okay, thank you, Yiwen. I'm always, you know, I feel so amazed when this, you know, when they found the right thing to support with their physio sessions, right? Definitely it helps achieve the result much more earlier than expected. Thank you so much, Yiwen. You have helped so many stroke patients throughout this year. Thank you so much. And the next one, I'd like to do a quick sharing. This is one of my high school friends. She was my class monitor, right? We have the same age, and then suddenly I saw that she keep on, you know, putting on weight uncontrollably. So share this IDX with her, and then she was actually an insurance agent, and then she literally know all the which doctors are good, you know, in which area. So because when she put on weight, right, she started to have hormone imbalance and started to have this heart hypertension. She has the heart palpitation, and also she started to have mood swing, you know, and weight gain, all these problems. You know, she keep on visiting different doctors to do this blood test, to test that marker, check in and out, you know, like it never really solve the problem. You know, the more and more problems keep coming in, right? So she started to get quite tired of it already. So when I shared this IDX with her, and then she immediately on board, you know, because she understand that this is the holistic kind of a plan for her in terms of her emotional detox as well. So she went through the IDX because she has quite some health issues, right, overall. So she commit herself for 120 days on the IDX detox program. So after the 120 days, she lost 10 kgs, and then you can see that she put down her chart, right? All the time when she checked on her blood pressures, right, it has always been yellow sign or the orange light or the red lights. But after the IDX, right, her this marking has been quite consistent on green light, green means good to go, right? So after IDX, she not only lost weight, she also reduced her body fat, and also in the tummy area, especially women, we don't like that spare tire. And then more importantly is her heart rate, and also her BP has been back to normal. So she no longer take the high blood pressure medication. And then one thing is she feels so much positive, and you know, she's very happy because back then to track up the Mount Everest base camp was actually one of her dream. But with her health condition back then, right, she told me, like, Fionn, it seems like I'm quite far away from my dream, you know, to achieve, to do my to go up to that Everest base camp. So after the IDX transitions, right, her transformation, she's able to keep to a healthy BMI. And then last year she managed to, you know, as you can see in her right picture, she finally conquered one of the dream that she has been having. You know, she climbed up to the Mount Everest base camp, and also she has been bringing this the transfer factor plus with her to help her to have a smoother journey, so that she didn't get infected or fall sick, because it was a very challenging journey of like about 15 days, and some of her teammates will actually have to take the helicopter and being rushed to the Kathmandu hospital during half of the trek, right? She said she was nearly about to fall sick, but luckily she said she has this immune booster with her, and then she's able to complete her whole trek. Yeah, so this is one of my case. And the next one I would like to share is another amazing case. I would like to invite Coach Hyun-san, who have helped her friends back in the hometown in Brunei. This is another one amazing case that all of you must really listen. It's a miracle story. So let's put a lot of AA to welcome Coach Hyun-san to share with us this case that she has helped.
Hello, Fionn. Thank you. Thank you for being inviting me to share on these cases, right? Okay, so I'm Hyun-san, and I was a lecturer 8 years ago, and I believe in science. I believe in transfer factor science, and also IDX program is a science-based. So in year 2021, I have introduced IDX program to my good friend Karen, who is stay in Brunei, and she is a well-known Bahasa Melayu tutor, the top Bahasa Melayu tutor in Brunei, okay, in a very rich country, right? So, however, as I know her, her health condition is not that good back in year 2021. And during that time, I know that IDX program can help. And so she actually think about a few months only started, because she saw her son's improvement on epilepsy. So that was another amazing case on how TF science have been helped epilepsy. So back to Karen's. So Karen's started IDX in December 2021. And during that time, she told me that I want to gain back my health. So she doesn't, she actually don't so much on slim down her body. But somehow the bonuses is so good that you can see the difference of before and after of doing IDX, right? The body shape, the edema has gone, the skin, the skin is glowing, right? So initially she's taking 120 days detox and on a clean diet. She is one of the coaches that I saw who are so disciplined, follow 120 days clean diets, right? And then for the first part is the fasting. And then what she had earned is that the blood pressure dropped down from 150 to 120. And doctor has reduced the dosage of her HBP medication from about 10 years. She took medication for 10 years already. Then only when she did IDX, then can see the HBP have been improved. So the medication can reduce. That was the first step. As I know until now, right, she is almost back to normal, like sometimes no need the HBP medication. So within about 2.5 year times, right? So another one is that she never thought that her blood sugar will be normal to 4.9, which is normal. Before this was about 5.6. So another health issue that had been helped her after the IDX is that the perforation of the eardrum is healed. And this is the case that previously for so many years, her eardrum actually perforated 3 times, repeated, right? And then doctor said the healing is almost impossible. But after doing IDX, she saw the cell regenerated. Okay, when she go for the follow-up of the eardrum, then the doctor see the eardrum cell is slowly growing. And this has been a great improvement. Because of this issue, the eardrum issue, she's always like in a dizzy state. Of course, sometimes with together with the high blood pressure condition. So this make her health very uncomfortable for her. Okay, especially she need to conduct classes. Okay. After that, also can see that her facial skin is firmer, less wrinkled, and looks younger. And one of the things that she is so happy is that the clothes and the pants are also loose. Total, she lost about 6 kg. Okay, and then this was the benefits of she's doing the first IDX. 1 year later, she did it another round of IDX, and this round she can see that the weight has become stable and also continuous improvement on her high blood pressure. And then the last one was she did it in this year January, which is she dropped another 4 kg and saw an improvement on uric acid. Uric acid dropped from 452 to 386. Furthermore, her triglyceride dropped from 2.6 to 1.8. So this is so great that can see that her health improvement is actually gradually being improved again and again when she did the IDX one followed by another. So during the last IDX program, she looks so beautiful and clean glowing that her student, when see her taking the photo and the video, treat her like a superstar. This made her so happy. Okay, and then she says that never imagined that has this kind of effect, like a superstar in front of her student. Yeah, when I listen to her, I can feel her excitement and happiness, right? for me, it's very glad that I can help my good friend to do this kind of health improvement. Yeah, it's really amazing. Thankful to IDX program. Thankful to founder who create VDEX founder that create IDX program, who helps lots of people gain back their true health and get rid of reduce the medication. Okay, and becomes looks younger. Okay, thank you, Fion.
Yeah, thank you, Coach Xiaosan. I think this is beyond words can describe, right? When ones can, you know, just did one program and they can get so many health benefits that they can never expected, and not even what the doctor can help them to solve, right? It was just amazing that, you know, like the science has discovered our body actually has the healing ability when we support it in the right way. And so many of us here have actually tested IDX really does help to, you know, activates the autophagy, like what Dr. Alfred has mentioned just now. This science has won the Nobel Prize Science back in 2016, right? So like definitely give IDX a try. And because we are a little bit behind, right? Because Dr. Alfred shares so many good stuff with us in the beginning, so we are a bit behind the schedule. So we want to thank all of you for stay tuned until this time, and then we have a great announcement to share with you. You know, like if you would like to know more, or if you have any more questions more about health, right, feel free to drop by, because on this coming Sunday, on April 28th, we will have our IDX Lifestyle Expo in the AC Hotel, which is formerly the Vistana Hotel. Okay, so we have this expo will be there from 2 to 6 p.m. Okay, with a lot of we have health consultation corner, we have healthy food and snack corner. If you do not know how to prepare healthy food, then do drop by and learn some quick tips. And also there will be product sampling corner, and also the health check corner. You can come to get your body scanning check, and also there will be exercise and fitness corner, as well as the business opportunity corner as well. So at different time, we also have different coaches from the VDEX will be sharing on in terms of the impact of stress, right? Like Dr. Alfred said, stress is also one of the contributing factors to the heart disease as well. Something not to take it too lightly. Okay, so we have many great topics lining up with all the great coaches. So do feel free to check with your friends who invite you for this talk tonight on our IDX Expo that's happening this Sunday. So, okay, I hope to see all of you this Sunday. Okay, and thank you, everyone. I hope that you all will have a good rest, and also please say thank you to your heart. Okay, because we have this heart never stopped beating since the day we were born. So tonight, before you go to sleep, right, please put your hand on your heart and tell your heart, hey heart, thank you so much for all the work that you have done for me all these years, right? So can we do that? Can we say some love to our heart? So thanks to everyone once again. Thank you so much for your time. So hope that all of you stay healthy and stay relaxed. Stay relaxed is important. Stay healthy and stay relaxed and be happy. Okay, so thank you, everyone. See you guys on Sunday. Okay, bye-bye, everyone. Have a good rest.